Hi, my name is Ulrika Hugo and I'm a social worker at Toro Hospital. Toro Hospital is a specialized psychiatric hospital, and working in this field requires social workers to have a good understanding of various psychiatric diagnoses. We work with a vulnerable population group, and as a social worker, we view our patients and their challenges in relation to the multiple contexts in which their challenges occurs. We pursue interventions that focus on our patients' social and political environments, as well as the psychological and interpersonal domains. As a social worker, we are trained to apply various theories to the treatment and prevention of psychosocial stresses. We are also guided by legislation and relevant policies. Social work in a mental health care setting includes a wide range of interventions like psychoeducation of the patient and their families, discharge planning, supportive counselling, crisis management, investigation of home circumstances, assessment regarding social grants and placement facilities, tracing families and identification of patients, reporting of abuse, and linking patients and their families with the appropriate resources within their communities. This is just a few interventions amongst many. Being part of a multidisciplinary team offers not only support to us as social workers, but it creates a space to collaborate with other disciplines so that the team can decide on the best treatment for the patient. As a social worker in this setting, I am aware of the important role we play in our patients' recovery and lives. This includes the following: helping patients and their families to obtain tangible services, hence advocating for their needs, counseling individuals, families, and groups to improve interpersonal relationships, creating awareness through outreach programs to address the stigma around mental illness, maintaining, restoring, and improving psychosocial functioning using a holistic approach, helping patients and their families enhance and more effectively utilize their own problem-solving and coping capacities by focusing on their strengths, facilitating interaction, modifying and strengthening relationships between patients and their families as well as their communities. I am proud to be a social worker, and it gives me great satisfaction knowing that I can make a difference in the lives of my patients. Thank you.
Good afternoon. My name is Nolubabalo Babs Lisani. I'm a social worker by profession and the head of department at Southern Hospital. I would like to give a brief overview about what is it that we do as social workers in the hospital. We try and provide efficient social work services in the hospital. I'm at a hospital where there's almost every department: the pediatric department, the maternity, the rehab unit, casualty, various OPD clinics. We do have medical wards, we do have gynae wards, we've got everything. So our role in the hospital is to make sure that we work as part of the multidisciplinary team, because there are medical conditions that are linked to social related issues. So we try and work in the MDT and make sure that we bring out, or we work with patients while the doctors are treating patients clinically. We focus on the social aspects with patients. We do child protection cases where we deal with cases of child abuse. We deal with patients that sometimes, most of the time, children and adults that are unknown patients, and in cases like those, we do follow protocols that we call standard operating procedures, where we will follow our protocols in tracing unknown patients. We also work with families, because we, as social workers, we focus, or we mainly work focusing on the holistic approach. While the patient is in the hospital, we also work with the families. We've got 2 psychiatric wards that are 72-hour facility, a small female ward and a male ward. We also do we work in the clinics. We've got a lot of clinics: ANC clinic, HIV clinic, outpatients, casualty. So social workers work in all areas in the hospital, both inpatients and also outpatients. One of our critical roles is to make sure that we work both with patients and families, because for patients to recover medically, they also require family support. We educate families about the role of family support in making sure that the patients recover speedily. We also do community work, we do food work programs, we do outreach in the community. So there's quite a range of work that we do as social workers. In a nutshell, this is what social work is in the health sector. Thank you very much.
Okay, my name is Talent. I'm a social worker in a substance abuse treatment center. People usually want to call them rehabilitation centers. So I just want to discuss selected roles of a social worker in a rehab center. So the first role is upon screening and admission. So prior to admission, referring social workers send psychosocial reports. So it is my duty as a social worker to assess whether the client fits our treatment program or not. Then I just want to discuss the treatment program. So the therapeutic program, myself as a social worker, I first assess the client, then I develop an individualized developmental plan, what you call an IDP. Then I have several counseling sessions with the client. Then towards 3 months, I start preparing the client for termination. Then it is my job as well as a social worker to motivate a client, because some clients come to rehab, but they are not fully ready for treatment. So it is my job to constantly motivate a client. So that's where skills like motivational interviewing come to play. Then it's also a job or a role of a social worker to empower the client. Some clients suffer from low self-esteem. It's my job to empower them so that they can know that they can overcome their addiction. Then during disciplinary hearings or multidisciplinary team hearings, the social worker usually chairs those hearing sessions or those disciplinary sessions. There is also case review sessions where we call a client as different professionals. There is nurses, there is social workers, there's addiction counselors. So the social worker, since a social worker is a case manager, it's your job to chair those treatment reviews. So as a case manager as well, as a social worker, I refer the client to different services, for instance, aftercare services. Then besides that as well, if a client has got legal issues, I handle the court work as well. If the client needs a progress report for court, I can do the progress report as a social worker. Then because I work for an NPO, we are funded by the Department of Social Development. It's a social worker's role to liaise with the funder, which is Department of Social Development. Then lastly, as a social worker, you need to do classes as well. It can be in small groups or it can be in large groups. So during group work, you do different life skills training, or you can do assertiveness classes, you name them. So those are some of the roles of a social worker in a rehabilitation center. But there is a lot of roles that a social worker plays, since you're the case manager and they're responsible for the client's progress in treatment. I thank you.
Good day. My name is Jeanette Sira. I'm a social worker. Currently, I work for an NGO called People Opposing Women Abuse. A lot of people know it by the name Power. I'm responsible for Power counseling services in Ekurhuleni region. Throughout my most years of being a counselor, I've come to realize one concept that is very important and that I believe that social workers should take note of. And that concept is power dynamics that exist in most relationships. It could be power dynamics in personal relationships, power dynamics in a working environment, and definitely power dynamics between a social worker and a client. It is important that social workers become aware of those power dynamics, because they also speaks to power and control. It is important that social workers, when they provide support to clients, they become objective and they don't impose their values and beliefs on a client. Social workers should provide an environment that allows a client to be able to look at their challenges and be able to come up with solutions themselves. In that way, clients are able to own up to the solutions that they've come up with. Clients should be treated with utmost humility and respect, and they should, throughout the process of counseling, they should feel that they are not judged and they are not forced to make decisions that they do not own. It is also important that social workers do self-introspection so that they know themselves and they are able to differentiate between their issues and that of clients that they are serving.
My name is Priscilla Hlangwane. I am a social worker at Randburg Clinic School. I am working with children who've been diagnosed with severe behavior disorder and autism. These children are exposed to domestic violence, divorce, child abuse, neglect, and the death of their family members. On my daily basis as a social worker, I apply the value of Ubuntu and empathy skills on individual clients or the individual cases that I normally deal with. I apply the value of Ubuntu as it helps a client to understand that they are not alone. There's a social worker who cares about them, who support them, who understand what they are going through. This helps the client to overcome their difficult situation and their challenges on a daily basis. And then I also work with group members on a daily basis, as most of our learners, they've got anger issues as they've been exposed to domestic violence. In the group, the learners learn to understand that most of them, they are coming from different family background whereby they've been exposed to domestic violence and abuse. So they understand that they are not alone. The value of Ubuntu bound them in the group to overcome their fears, their anger, their violent behavior. At the end of the day, our learners learn coping skills, social skills, and problem-solving skills as they are no longer screaming and shouting or displaying anger outbursts. And then they learn how to communicate their frustration and their feelings and thoughts. We also work with their parents, whereby we teach our parents in the parent support group to understand their learners, their own children better, as our parents believe in punishment and giving their children hiding. So in the parent support group, we teach parents to use reward child positive reinforcement, as they need to learn to praise their own children, as if they don't praise their own children, who will praise their children? So it helps our parents to learn that even if they've got a child with a special need, there's help out there, they are not alone in their situation. So the value of Ubuntu helps me as a social worker to learn that a person is a person through other person, as the value of Ubuntu helps a professional to learn every day on the daily basis. Thank you.
Greetings, colleagues. My name is Kinelo Dibusa. I am a social worker. I work for Joburg Child Welfare. I work at Ntabiseng Tutuzela Care Center in Baragwana Academic Hospital. I work for a department called Child Abuse Treatment and Training Services. I offer counseling services for sexual abused children and their families. Basically, what I do is that I offer psychosocial services, which is I do therapy, I do group work, I do parenting programs for the parents and the caregivers of the children, and I do community outreach with the stakeholders that we work with here at Ntabiseng. As some of you would know, is that at TCCs we work with stakeholders such as the NPA subs, the Department of Health, and other organizations. So all in all, what I do is that I offer child protection services, and if I see that the child is in need of care protection, I refer to my colleagues at Joburg Child Welfare for statutory services. As a social worker, I pride myself by putting my clients first and treating them with dignity and respect. Yeah, so I believe that's what Ubuntu is all about. Thank you.
My name is Anele. I'm a clinical psychologist at Tara. And Tara is a very small community where all the professionals try and contribute and work together for the best patient care possible. And social work has been a very important part of the patient care here. I think working with social work since I've been here has enlightened me on how dynamic the work they do is. And typically when we think social work, we think removal of children, we think dealing with household social issues. What I've learned about their contribution is the therapeutic part of it, that our social workers do family sessions, do some therapies with patients, and are very thoughtful and skilled in getting the best outcomes from our treatment. I find social work to be very diligent and committed to their patients. I'm not sure if that's part of their training, but the level of commitment showing up, having things ready, reports ready, seeing people, commitment throughout in all the different areas that they needed. It's very inspiring to see, and I hope they are appreciated, they feel as appreciated as we find them to be helpful and useful and thoughtful.
I am Nokbongam Kabela, a fourth-year student social worker at the University of the Witwatersrand. Now, I wanted to be a social worker because you know how when we go through difficult situations, we all need that one or two people who are able to partner with us and encourage us along the journey while we face whatever storm we may be facing. And so I wanted to be that person that partners with people to see situations through the lenses of a solution. You know, I wanted to be that person that empowers people, that encourages people so that they're able to help themselves get out of the situation, you know. Another reason is, you know how whatever family we come from, they are the ones that shape us into being the people that we are. Now, we know that a lot of us in South Africa actually come from dysfunctional families, and whatever the family shapes you to be, that's the person you are most probably gonna be in the future. So I wanted to be that person who has a helping hand in making sure that families are functional, because our families shape us. The family that we come from determines the person that we might be in the future. And that is basically why I chose to be a social worker. Thank you.
Hello everybody, my name is Pure Mashiane and I'm currently doing my fourth year in social work at the University of the Witwatersrand. Being a social worker to me means that I get to live my dream of working with people every day. But not only that, it means that I have the necessary skills to bring about the change in the lives of individuals, of groups and communities through identifying areas in which they have been disempowered and working towards bringing that power back to them. Thank you.
Good day, ladies and gentlemen. I would like to talk about our social work degree. First of all, social work is a multifaceted profession which concerns itself with the multi-level challenges that are facing our individuals, families, and communities. It forms part of the broader social service profession, and it's the Bachelor of Social Work is a 4-year program or training program through which the students develop their practice skills, and these practice skills they develop through the training workshops, the field instruction, and the placements in various organizations where they practice under the supervision of experienced social workers. They also learn theory in the 4 years. They learn theory in social work, and our other theories are derived from the profession knowledge-based, such as psychology, sociology, and other related fields. And social workers, once they have graduated, they work in various fields, such as the child protection, the community, child and family welfare, youth programs, disability, health, workplace, education, social policy development, forensics, and various others. So once they graduate 4th year, they can move then to doing their masters. So after the social work, the 4-year degree, you do your masters, and the masters you can specialize in various fields that some of them I've just highlighted now. At the University of the Witwatersrand, we offer 3 specializations, which is the Masters in Occupational Social Work, we offer Masters in Social Development, And recently we are offering also the school social work program. So you can do those, and other institutions offer various other specializations. And the role of the social work really, and beyond the masters, you can also do your doctoral or doctorate. And the role of the social work can be broadly divided into two, main categories, which is the direct practice or indirect practice. With the direct practice, that's where we offer, our services as social workers, like problem solving with individuals, families, groups, and also the communities. And you also link people to the systems, or link systems to the people. We also, are responsible also for developing the systems ourselves. So we work and we do program developer, we are planners, and we do the policies. And once those systems are developed, it is also the social workers who actually maintain those. Like, we work as facilitators and as team members or consultants. So that's part of what we do as social workers. And of course, we know that the South African welfare system has manifested in the integration of the social services, and this integration has led to an increased demand, for social service professions. The Department of Social Work at VETS has a very long history, and the proud history of over 90 years, where many of our staff and graduates have played a critical role in the development of the social South African policies, and also in the struggle for freedom and democracy in our country. And it continues to strive to be the center of excellence in the social work education and training in South Africa, in the region, internationally, and promote social development, social change, well-being of people through the research that we do, through the teaching, and through the community services. Thank you.